Oh, it's Dr. Rachel Brown, Medical Director of Prevention and Wellness with Business Health Solutions at Prisma Health. And this is December's COVID and Wellness Monthly Update. Today is December 10th. So if you're watching this anytime after December 10th, understand that information may have changed. Let's go ahead and talk about what the status of COVID is right now in our state. And sadly, the last time I talked to you, we were seeing some really terrific numbers. That is no longer the case. Most of you have probably heard that we're likely going to be facing yet another surge for lots of different reasons. But let me share my screen and let's take a look at what information there is out there from DHEC on what the cases are doing right now. So when you look at DHEC's county level data, what will happen is it'll show you a map of our state and it'll show which counties are low, moderate, or high incidence of COVID. And the last time I showed you this, almost our entire state was in that moderate incidence category. But look, the upstate is back to being in the high incidence of COVID. We're not back to surge levels yet, but when you look at this graph that describes our surges in the past, you can see we're starting to go up here. Those of us who follow this data very closely notice a little blip right before a big surge, and we're starting to feel a little bit nervous that that's what's coming. With the holidays coming and folks traveling and gathering, we expect to see in the new year another big surge. Omicron may or may not be a part of that, and we'll talk about that in just a second. The other thing I do want to share with you is that the percent positive, which is sort of that indirect indicator of disease prevalence across our state that we've been using, was around the 3%, maybe 4% mark last month. It is now up to 9.6. So again, we are seeing more and more cases. So let's talk very briefly about Omicron. We don't know a ton yet on what this is going to look like, but we do know that it is out there. And of course, we have seen cases in the US as well. So we're going to expect to see that, just like we saw Delta. We don't know much about the characteristics of Omicron other than it looks to be more infectious than the original strain of COVID. That will sound familiar. That's what Delta was like. It does have more mutations than the Delta variant had. Some of those mutations are being studied and have been shown to affect that spike protein, which we expect, and that makes it more infectious, just like the Delta variant. But other researchers are looking at what's happening to the antibody interaction in our bodies because of those mutations. And there seems to be a little bit of worry there that we might not have as good an antibody response. Now, the good news is all the preliminary data shows that folks who have been vaccinated, especially folks who've received the booster, either 6 months after an mRNA vaccine, Pfizer or Moderna, or 2 months after the J&J vaccine, seem to have very good protection, okay, against Omicron. So again, getting vaccinated and getting your booster is going to be the best approach to managing Omicron if that's part of what that surge is from. We are going to see a bigger surge in areas where we see lower rates of vaccination, health disparities. So folks who have high rates of chronic disease and who already have poor access to health care, and in places that aren't prepared. They have less testing, they have less tracking, and they have less training for doing some of these things to get folks vaccinated or tested, or understanding the exposure and contact guidelines. So I'm going to talk about each of those and how we can help you with each of those. But what I also want to share with you is that the other thing about Omicron is that in the unvaccinated, of course, we are seeing this more and more. But we're also seeing this in folks who had previous infection, usually with Delta, because that's the predominant strain right now. And so it's not like before when we felt like you had some bit of protection if you had already been infected with COVID. Omicron seems to be able to get right past that. So I really encourage you to share with your leaders and your workforce. Those folks who think they are protected because they've had COVID will not necessarily be protected against Omicron. That is definitely something that's starting to bear out in the literature, okay? So to summarize, it's a brand new variant. This is going to continue to happen as long as there is spread of this disease. That's what happens when there's spread. Viruses mutate, okay? So this is going to be a recurrent story until we're able to keep this virus from spreading, primarily through vaccination. So we've got this new variant, has many, many mutations. It is not looking to be protected against by previous infection. It does look like you're protected if you have been vaccinated, especially if you've gotten the booster. So that's that summary there. So let's talk about what you can do in your organization with your leaders and your workforce to manage the surge that's coming. Like I said, part of this is waning immunization. Part of this is holiday behaviors and getting together and traveling. And part of this may be Omicron. We don't know yet how much of a significance that's going to be for this latest surge that's predicted. But if we look back at the places where we already know, such as Michigan, who's going to have the worst time with this? We talked about vaccinations, we talked about health disparities and access, and we talked about preparation. So what can you do? Let's take a look at our vaccine dashboard so we can see what's going on here in South Carolina. Give me just a moment. There we go. Okay. So the vaccine dashboard looks a little different than it did last month. They have added in a couple of columns. Here is the column to show how many of our children below the age of 11 or between the ages of 5 and 11 have gotten the vaccine. You can see that not many at all of our South Carolinian children have been fully vaccinated. This was a new recommendation since the last time we spoke, and we are hoping to see more and more grade school kids get vaccinated. When you look at everybody else, so everyone older than 11, we have about 55-ish% of our South Carolinians who are fully vaccinated. And then that number goes down a little bit when you simply think of everyone between the ages of 5 and older. So on average, we've got about half of our population, if you include the young kids in that number, that have been vaccinated. That is not enough to stop the spread of COVID. And if Omicron comes to South Carolina, 50% of fully vaccinated South Carolinians is not enough to keep that from creating a huge surge, especially among folks who may feel that they're protected because they had previous infection, because that is not bearing out. So renew your efforts at getting folks vaccinated. Renew your efforts at getting folks to get the booster, because it's looking like it's really necessary to have that third shot to really be protected against these newer variants that are coming down the pike. In fact, there's some discussion that the CDC may move to say that the 3-shot series of the mRNA vaccines, which would include that booster shot, is what would be considered fully vaccinated. So suddenly this number may go down if folks who haven't gotten that booster shot are considered only partially vaccinated. Okay, so that's how important that booster is. So we can do that for you. We can have vaccine clinics for you and host those. We can get first shots in arms, we can get second shots in arms, and we can get boosters in arms for you. Please have us come out and do that for you. I do want to reiterate that the booster shot is still only FDA approved and CDC approved for 18 years and older, but Pfizer is saying that they're going to request FDA authorization for booster shots in 16 and 17-year-olds. They say next year. The word on the street is that they're going to apply sometime in January, which would mean that all of those 16 and 17-year-olds who were vaccinated in the beginning of the year, who are actually past their 6-month point, could get that booster shot, which would be great. And hopefully we'll see more data for our 12-year-olds, 12 to 16-year-olds as well. One last thing I also do want to reiterate, in case you get asked this question, folks do not have to wait 90 days after having a COVID infection to get their shot. Some folks decide they want to because they think they're immune for at least 30 days, But again, that's not the case unless you're exposed to the version of COVID that you caught, and certainly not the case with Omicron. So as soon as a person's isolation period is up, if they've caught COVID, they can get their immunization. So they can get their immunization as soon as 10 days after having COVID. Okay. All right, let's move on to number 2, the idea of folks with chronic disease and folks with lower access to health care. And I'm going to stop sharing my screen for just a moment as we move away from some of these resources. So we've known for a very long time that folks with diabetes, hypertension, heart disease, obesity, lung disease, and smokers, others with immunocompromised states, have much worse consequences from COVID, right? We know that folks who don't have good access to health care, either due to transportation or childcare or a paucity of healthcare resources in their communities, also do not do as well when they have COVID. And the people who have both of those going on in their lives do not fare well at all. And they have very, very bad consequences from COVID, and especially if they are not vaccinated. So there's a renewed energy. It never went away, but there's a renewed energy at really, really reaching out to the members of your workforce, the members of our community who could be even more severely affected by COVID, either because of chronic disease or because of lack of healthcare access. We can help with that. Please ask us to come in and talk with groups. Maybe you put together a support group for diabetic workers, and we can come in and talk to them about COVID, about what it means, talk to them about the vaccine, talk to them about how to get healthcare access. We can set people up with primary care physicians, okay? We can tell you how your workforce can access e-visits. Please use us to get your workforce the care that they need and the access that they need and the information they need to consider vaccination, right? Or to consider getting tested more often, or to know how to get the care that they need if they start to feel bad. I want to tell you that we also can do flu clinics. So when we talk about coming in for vaccine clinics for COVID, flu is just as important, and it's going to be just as significantly consequential for that group that I was just talking about, folks who don't have great access to healthcare, who have chronic disease. So please don't forget about flu for everyone, but especially when you're talking about folks who are already at risk. So we can do those clinics for you as well and bring you the flu clinic. Let's talk about preparing communities that are not prepared for surges. Part of that is healthcare access, but the other part of that is testing and contact tracing. So for you all as an organization, you've been through this long enough to know that it is in your best interest to make sure you know as soon as possible who has COVID and who may or may not have been exposed to that person and what the quarantine rules are. So just to review, if someone has symptoms and they are tested and they are positive, they should isolate, meaning of course not come to work, but not even leave their homes, and isolate if they can from members of their household for 10 days from the start of symptoms. If they just happen to be tested for another reason, they never had symptoms, then you start that 10 days from the day of the test. After that, if you're looking at your workforce and who may have been exposed to that person, your worker who had COVID, certainly household members have a high level of exposure, right? And so you're going to really be concerned about those folks if they are also your workers. But anyone else in the workplace who was within 6 feet without a mask for greater than 15 minutes total throughout the day is considered an exposure. We've talked for, gosh, over a year now about how hard it is sometimes to determine who is an exposure and who isn't. And we can help you with that. We can help you march through these cases and these situations and help you to know who's best to quarantine and who probably doesn't need to quarantine. I can tell you that anyone who's been vaccinated doesn't have to quarantine. We recommend they wear a mask for 14 days. We recommend that they watch closely, and they should be anyway, right? We recommend that we watch closely for symptoms and get tested if any symptoms pop up at all. But if you're vaccinated, you're feeling pretty good that person is not going to either be infected or be a high source of transmission, although it is possible. Okay, it's your unvaccinated workers who are exposed that you're concerned about, and the most I think least disruptive to productivity is the strategy of quarantining that person for 7 days from the time of their exposure, testing them on day 5. And if that test is negative on day 5, they can come back over after those 7 days. If you want to be a little bit more aggressive, have them quarantine for 10 days. And if you want to be the most aggressive and really know for sure that you are lowering your risk of outbreak within your workforce, they can quarantine for 14 days. And sometimes this is possible in situations where folks may be able to work from home or other situations that you might be in. All of those are legitimate ways to mitigate outbreaks. They're not 100% perfect, okay? So again, as you maneuver through those gray areas, because the cases always are gray, please reach out to us and let us help you as you walk through those. Now, when we talk about testing, that's a big question we get now because it's tough to get it, right? It's already difficult to get a team member, or excuse me, a worker tested if they have symptoms. Not every organization has an on-site clinic that might be able to do this. Sometimes it's difficult for folks to be out of work to go get a test from CVS or from their doctor's office or from some other healthcare system or some other laboratory. You may be concerned about home tests and whether or not they're reliable or whether or not you should be proctoring them in any way. Again, reach out to us about the best way to work through your protocols and policies for testing. We can do trainings to help you to understand what a home test may look like. And maybe you do decide to proctor those. And what would it mean for you all? What kind of training would you need to be able to proctor a home test or other tests that you do on site? When we talk about the ETS, the OSHA ETS, and we move into the concept of surveillance testing. So now we're not talking about testing folks who may have been exposed or who are sick, but we're talking about the weekly testing for the percentage of your workforce that is not vaccinated. And for some of you, that percentage is really significant, correct? That is something that we're getting a lot of questions about. Good news is that all of you must know is that is on hold for now. But as you are thinking about how you might approach that mandate, if it does come to pass, again, please reach out to us. We cannot, of course, supply resources and personnel to test that many number of people at all of the organizations and businesses in South Carolina, but we can work with you to figure out the best solution for you. I will also tell you that Prisma Health as a system is looking at this and how we may be able to help with, for instance, bringing mobile units on site to help test for surveillance. Of course, we're all waiting with fingers crossed to find out what the mandate will end up being and what the court decides. So we're all in that limbo period now. But as you're beginning to think it out and flesh out your plan, please reach out to us so that we can help you with that. Okay, the last thing I want to talk about is in the well-being category. And from time to time, I've talked with you about emotional well-being because boy, has it been an incredible 20 months. And our workers, our community, everyone has been through a roller coaster of a ride. And one of the latest phenomenons that we're noticing is something called languishing. So I'm going to share my screen one more time to share this resource with you. There's a fellow named Adam Grant who wrote an article for the New York Times about languishing, and it really resonated with folks. And here it is in case you need it as a resource. So if you go to the New York Times and look for Adam Grant languishing, you'll see this article here. And basically what it's describing is what you've probably all noted and maybe not put a word to, and that is that there's a large segment of our population that's really struggling. I'm thinking of our healthcare workers, for instance, who have been pummeled, especially over the last few months with so many sick folks and the demoralizing, heartbreaking feeling that they have taken care of folks who have diseases that could have been prevented. But there's also a huge segment of our population who may not be in crisis, but are still feeling aimless and joyless, and they almost can't put a word to what they're describing. And they'll tell me, well, I'm not depressed, but I'm also not really happy. I hear people say all the time, it just feels like Groundhog Day, or they say they feel aimless or joyless. I've had people say, well, I'm really busy, but I'm also really bored. And all of this is just that uninspiredness. Okay. This is a long 20 months that we've been through. We are psychologically burdened with not knowing what the end is going to look like and when the end of this is coming. And we try to get back to normalcy, and yet at every turn something abnormal has to happen, right? We put on a mask, or suddenly there's a new variant. And so all of that sort of combines into this sense of languishing. So a lot of your team members who aren't in crisis may be suffering, but not in that same way. So I encourage you to take a look at this article just to kind of understand this concept, maybe share it with leaders. The solution, I will tell you, I'll go ahead and give you the punchline, is really helping to find folks find something. Maybe that's passion in what they're doing at work or at home. Maybe it's fun, levity, lightness. Maybe it's newness, something brand new at work in their job, a new responsibility, a new creative outlet. But it's all about purpose, and it's all about lightness and joy. And that small steps can go a long way. I'll give you an example of something we did here at Prisma Health. This was inspired by our CNO of nursing, Carolyn Swinton, and she noticed that folks were in crisis, but also noticed that folks who weren't in crisis were still in pain and still struggling. And so she worked with our spiritual care and education folks and our workforce well-being folks. And we put together holiday music concerts on every campus. And I have been to them, and I see people come in and just hearing music, just stopping for a moment and getting out of their routine, taking a second to breathe and sing along maybe, or clap, or get a small Cersei or treat, has made all the difference in the world. So even very small interventions can help with languishing and even help folks who are in crisis. I will leave you, of course, with our website. So if you go to Prisma Health Creating a Safer Workplace and scroll down, you can always share these videos from here with anyone you'd like to share them with. And this is how you reach us. Okay. Ask us about vaccine clinics for COVID and flu. Ask us about mitigating testing. Ask us about sharing information with your workforce. What is it that you have questions about that you need us to help you walk through? We're here for you. So please remember that we are here to take care of you so you can take care of your workforce. Reach out to us anytime. Have a wonderful holiday season and a safe new year, and I will see you in 2022.